Hi, my name is Noah Cornelius, and today I will be presenting my research paper on mental health differences in different cultures/countries. Introduction. Mental health is crucial to individual functioning. As poor mental health hinders informed decision-making, modern society faces rising mental health challenges. Prompting healthcare providers to encourage activities for improvement, studies show that community issues contribute to mental health problems. As individuals often keep their struggles private, increased life pressures have resulted in common issues like depression, anxiety, stress, and substance abuse. Different communities experience varying levels of mental health problems due to diverse perceptions of mental health. This essay will discuss how mental health varies across cultures, supported by factors influencing these differences. Background information. Mental health varies across cultures due to social, cultural, and environmental factors. Issues differ based on cultural perception. Studies show more females report mental health issues than males. However, this doesn't mean women have more problems, as men may hide their struggles due to societal beliefs that discourage sharing. Consequently, men often suffer in silence. Additionally, negative attitudes and stigma towards mental health in some cultures further exacerbate this issue, leading to silent suffering among community members. Mental health and among people with disabilities. Studies indicate that people with disabilities are more likely to experience high levels of mental health issues because they often lack opportunities for self-expression in society. For instance, Augustad in his study examined visually impaired children and young adults across 13 different countries and found that they are prone to emotional stress and mental health problems, with girls showing higher levels of anxiety and depression. The author noted that even in the general population, women report more mental health issues than men. However, this could be attributed to cultural stigmas that discourage males from expressing their emotions and seeking help. Factors contributing to high incidence of mental health issues among the visually impaired include limited access to mental health services and social isolation, as they are often marginalized and people may not interact with them in many cultures. This isolation exacerbates their stress and mental health challenges. Mental health and cultural practices and beliefs. Cultural practices and beliefs significantly influence healthcare access, especially in mental health, where stigma and attitudes can worsen conditions. Cultural backgrounds determine whether individuals seek mental health care, and linguistic diversity can hinder access to services, leading to higher mental health issues in some communities, as stated in the core article. Communication barriers between therapists and patients speaking different languages can impede effective therapy. In certain cultures, norms prohibit male doctors from treating female patients and vice versa, limiting access to care. Additionally, seeking mental health help may be seen as a sign of weakness, particularly among men, causing them to conceal their problems due to fear of societal judgment. For a community to achieve quality mental health services, practitioners must formulate healthcare programs incorporating cultural elements and respecting cultural diversity, as stated in the article written by Nastasi and others. This will ensure that more people can access mental health care services without the fear of them going against their cultural practices and beliefs, hence increasing solutions for mental health issues. For instance, healthcare practitioners should ensure that when they post physicians or therapists in a particular community, the ones who mainly interact with patients should be able to communicate in their language to avoid the language barrier. Additionally, when formulating community-based health programs such as rehabilitation, it is necessary for practitioners to ensure that the program embraces practices that are culturally sensitive to ensure that people can seek mental health care help without feeling their cultural practices are compromised. Mental health and socioeconomic class. Mental health issues are increasing in communities and countries where most people are in the middle and lower economic classes, mainly due to life difficulties and lack of access to proper healthcare services. These areas receive less attention, leading to continued suffering from mental health problems. During COVID-19, there was a notable rise in mental health issues in these regions, as stated in the Hail Miriam and Pathair article. Countries with higher percentages of low and middle income earners show elevated levels of mental health problems due to healthcare challenges and disparities. According to Hail Miriam and Pathair, these countries also have a higher number of refugees, which exacerbates mental health issues. Specifically, they mention Africa and Asia with the exception of China, as regions significantly affected during COVID with high cases of mental health problems. Mental health and religion. An individual's religion significantly influences their mental health by shaping how they understand, experience, and cope with mental health issues. Studies show that this relationship is complex and can be either positive or negative, depending on uh, cultural and religious beliefs. Some religions interpret mental health problems as possession and address them through prayer, which may lead to deterioration due to lack of proper treatment and increased stereotyping and isolation. Conversely, other religions support those with mental illness, encouraging therapy and even providing rehabilitation centers. A study by Ismail and others found that religious values like piety and hope positively enhance mental health and well-being. However, the study also indicated that beyond religion, other psychological factors significantly influence an individual's mental health. Mental health and social media. With recent advancements in tech, there has been increased use of social media. According to several studies, it has been identified that too much use of social media has contributed to increased mental health issues. Additionally, the studies show that most people who are likely to have mental health problems are the ones who are social media addicts. They spend too much time and fail to interact with society around them. Similarly, male students were identified to show higher levels of mental problems because they are likely to become addicts. Additionally, social media users have increased mental health problems because they spend too much time and do not have enough time to sleep, as stated in the article written by Karaman. Similarly, studies have also shown that there are increased mental health problems among adolescents. This is because the adolescent's ability to react to various stressors is not fully developed, and hence they have higher chances of experiencing mental health problems. Additionally, their ability to interact with their culture is also affected. Therefore, they should be helped to ensure that they have ease of interacting with their cultural practices to reduce their exposure to mental health, as stated in the article by Nastasi. Mental health and parenting. Mental health has become a problem in the community. It also affects an individual's parenting ability, especially for parents taking care of children with special needs, such as autism. A study has been conducted to understand interaction of mental health and parenting. People involved were Australian parents in Southeast Asia. According to the study, individualist culture parents, the Australian, and collective culture parents with Southeast Asia origin. Those parenting autistic children and the individualist parents showed higher level of mental health problems compared to the collectivist culture. Therefore, for parents raising autistic children, their lives are affected. Hence, they show a life with low well-being as well as higher level of mental health problems. Mental health issues persist in society, affecting individuals differently due to cultural diversity. Mental health care providers should create culturally aware programs to address these challenges, as stated in Zara Bagheri's article. It's vital to resolve disparities in mental health services, particularly for low and middle socioeconomic communities, ensuring everyone has access. Furthermore, support for persons with disabilities is crucial in reducing mental health problems. Parents of children with disabilities also need therapy and assistance to enhance their well-being and mitigate mental health issues. And these are my references. Thank you for listening to my article.